Okay, so I'm going to be trimming the teeth to do the setup on your quadrant setup exercise here. I would normally, I'm using my bench lathe. I would normally use my large white fast cut stone for this, but I appear to have taken them to school or given them away. So I don't have any available to me here, so I'm using a heatless stone. I have my safety glasses on. I'm just going to round the corners of the heatless stone a little with the dressing stone. I'm going to use the white ceramic stone and a round burr in my handpiece for finer adjustments. So grab the stone grab the tooth that you want to set, take a look at it. I have to remove almost 4 millimeters from the neck to get it down to a good length, and I'm going to have to bring the neck, I'm going to have to thin the neck a little bit. I was saying that first off, I learned to do this by using a bench lathe, not a handpiece, so I'm comfortable doing this. A lot of people now seem to go straight to the handpiece because, the handpiece is just cooler. The problem with the handpiece is that you're holding the handpiece, or one of the problems with the handpiece, is you're holding the handpiece with one hand and the tooth with the other, and the tooth can go flying really easily and quickly. With the bench lathe like this, I've got quite good control of what I'm doing, and I've got both hands on the tooth, so that I've got little chance that I'm going to lose the tooth. Now, as I said, I would prefer to use the big fast cut white stone to do this, because it's faster. This one is a little slower, which for you at this stage might be not a bad idea to do it a little bit slower. Going slower lets you, going faster lets you make mistakes faster. So slowing down is not a bad thing. So much as we did last week, I'm just trimming the tooth. I'm trimming the tooth on a curve, on an arc of its ridge lap. I'm not just making the tooth flat in any way. Then I'm putting it on, I'm taking a look at where it needs more reduction. I need to bring the neck of the tooth in still, so I'm going to trim primarily right up here at the neck of the tooth, but I'm also going to thin this area in here. I'm also looking at where it's going to run into the model on the lingual here. Remember what we talked about. With most teeth, you're going to want to remove a little bit on the mesial and proximal, not just a little more on the mesial and proximal, not just leave it straight across. And that's because, in general, the remaining bone of the socket is going to curve up on the mesial and distal of each tooth, which is going to give you less room to the mesial and distal. So you generally have to do a little bit more reduction there. Okay, so that's now looking fairly reasonable. So what you should do is now wax this into the position that you want. Now, I suggest you use the minimum amount of wax. Melt just a drop of, just a little bit of base plate, or I prefer to warm the base plate and stick it on. I will demonstrate that in a minute. However, my setup here, I don't have my Bunsen. I actually should just go get my Bunsen. I should have brought my Bunsen over. I'm just going to take a piece of sticky wax. You should not do this. This is not a good way to do a setup, but I don't want to spend forever doing this with you. So I'm going to put the tooth in there. I'm going to align the tooth, and then you can start on the lateral. And we do basically the same thing on the lateral. Lateral is going to take, again, a good bit of trimming, because we have to take that with it. Take a fair amount off of the ridge lap here. Now, having a little bit of space to the lingual of the tooth doesn't bother me, because that just means I'm going to have acrylic under there to strengthen the denture and bond the tooth. Ironically, if you have the tooth fitting too well, then you don't get much acrylic under it to give you a good strong bond to the denture. Just going to take shorten the neck just a touch. Okay, so it's just being held out at the neck a little here, which means we'll have to shorten the neck a bit and just hollow out that neck a little bit more. Take a little off the distal and a little off the mesial. Again, you should not use this wax. You should use base plate wax. I will be going back and resetting these in base plate wax, but I don't have. You see how they move around very easily. So it's just way too easy to end up with your tooth in the wrong place. So just create your arc to match the other side. This is very much a do as I say, not as I do, because I'm using the wrong wax for this. Because my lab was originally set up to do ortho, we don't do wax, and we seldom do wax and trimming at the same time. So my trimming station and my wire bending and wax up stations are different places. And I keep my Bunsen away from the trimming area because all of this trimming debris is really, really flammable. If you ever, it is possible to set it on fire, and that gets mildly exciting. Done that, that's why I keep my Bunsens away from the area where I do the trimming. So I'm not going to spend a ton of time making these perfect, but that gives you an idea of the setup. Your posterior teeth are basically more of the same. You're going to set the posteriors. You're going to follow the occlusal plane of the other side. So just when you look at the teeth, they're going to be, or the occlusal plane, when you look at your setup, your occlusal plane will be flat across the two quadrants. As you're doing in your complete denture class, you're going to make the long axis of the premolars so that they're perpendicular to the occlusal plane. Again, the reason I like doing this with my bench lathe, if I can, is because I can hold this tooth with two hands while I'm trimming it. And then I don't have to go searching for my teeth nearly as often. Okay. So I stopped and went and got my Bunsen and reading glasses so that I could see what I'm doing better. So now I'm going to wax the teeth of the anteriors into their position instead of doing it the wrong way with the utility wax. Try not to set anything on fire here while I'm at it. So as you could see from the little pieces of the white wax I was using, you don't need a huge amount of wax to set these teeth in place. Just a drop. Just put them in with a drop of wax. Make sure you look at it from the occlusal, or the incisal, to make sure it lines up from the incisal. Now you don't have to use a drop. You can also take a little piece of base plate and warm it up and rip it off and use it for setting the teeth. So I'm just going to take a piece of base plate. I'm going to warm the end of it a little, rip it off, jam it in there where I want the tooth to go. This is the way I would normally set up a full denture, because usually with a full denture you've got more space that you need to fill with the wax. With a partial like this, you usually don't have a whole lot of room for the under the teeth, so there's not a lot of room or need for wax. With your full denture, sometimes you need to have extra wax under the teeth. And that's where I like to use the piece of base plate. Warm it, just take off a little bit. I use the minimum amount of wax that I can, because the more wax you have, the harder it is to heat and the harder it is to control where your teeth are going. You want the wax, anytime you're setting teeth, you want the wax to be really soft, really well melted, so that you're able to put the teeth where you want. If your wax isn't completely melted, then the wax is hard enough to push the teeth to where the wax wants the teeth to go. So I'm going to redo the posterior teeth here. So we're going to sure that the necks of the posteriors are not sticking out too far. Again, just a tiny little piece of wax. You do not need a lot of wax. Soften it, and then use an instrument to melt it, make it nice and soft. And then set your tooth. And then check that you've set your tooth where you want it. And then go on to the next one. Should check the tooth just to make sure of how much you have to remove to get it to fit. Sometimes you don't have to remove any. A lot of partials you are going to have to remove some, if not a lot. Some patients, especially younger patients, you're going to be trimming the tooth down to almost nothing. I keep blowing on things because, as I said, this area is not meant for setups, and so it's much dustier than it should be. I would never work on a patient's setup here. Make your premolars so that their long axis is perpendicular to the occlusal plane, and their occlusal long axis is perpendicular to the buccal of the teeth. Don't have these teeth all crooked and rotated to each other. So my suggestion with setups is don't agonize over each tooth. Prepare, trim the teeth, put them in approximately where you want them to go. And then once you've got all of the teeth in place, then go back and make sure that they all align properly the way you want them to each other. Because if you spend a ton of time trying to make the first tooth perfect, you often find that when you set the second tooth in place, it's not exactly, the first tooth is no longer exactly where you wanted it to be. So you set the second tooth, and then you have to go back and set the first tooth. In your dentures, I'm sure you talked about how the buccal cusps of the posterior teeth should be in alignment. It should be in a line, and then your first molar should turn about 6 degrees, like that. again, lining up the cusps so that the 4 buckle cusps of the 6 and 7 are in a nice straight line and all touching a straight line. And we want our occlusal plane to match the other side. So I could, I'm not going to spend a lot of time at this and bore you to death. It's on approximately the right occlusal plane. This one's coming down a little here, so I could lengthen these a touch. But yeah, if you can get an occlusal plane that goes like that, I'll be pretty satisfied with that. Okay. Okay, so now we can go over and start doing our wax up. So I'm going to move over to my clean bench where I can do a wax up.